Welcome back to Our Nation This Week with the News Forum. My name is Faytene. With me right now, I have former Member of Parliament, James Lunney. He served in British Columbia, Nanaimo, Alberni, and he was also a part of the Conservative Caucus, the Canadian Alliance Caucus, and actually ended his term as a Member of Parliament after 15, 16 years. Serving as an independent so he could speak out on some freedom of conscience issues. But he is with me right now. Now, James, you served on the Parliamentary Health Committee for years. Is that correct?
Correct. Yes, I did. Great privilege.
And in 2000, go ahead.
No, go ahead. Yeah.
In 2012, you brought forward a bill out of a heart to see the immune system of Canadians strengthened through a vitamin called D3. Unpack that for us, the motivation you had in 2012 and how that relates to the health conversation that we're having in Canada right now surrounding COVID-19.
Well, of course, I was a healthcare practitioner for 24 years before I was elected. And, I practiced as a chiropractor a lot like a naturopath. Bottom line is I introduced a bill in 2012 related to create a national vitamin D day. And why did I do that? It had to do with, I got my enthusiasm for D from a medical clinic that treated cancer patients in British Columbia called Inspire Health. And they were getting better outcomes with their cancer patients. BC has good statistics. And this group of 4 GPs got a grant from the Canadian Cancer Society to treat the patients, not the cancer. Oncologists were managing the same, but their program was getting better outcomes. The government awarded them a grant for some $12 billion to extend their outreach to outlying communities. And one of their prime strategies was maximizing or optimizing the vitamin D. So I had a bill in 2012 called a bill to create a National Vitamin D Day on November the 2nd to alert Canadians that we're going into our vitamin D winter and you need to supplement because the sun has gone too far south. You're not going to produce any in Canada. You have to supplement. And so that was back in 2012. It never passed because it was a private member's bill and we only have so much opportunity. But given this, it gets tied into this COVID story today. And COVID-19, the lockdown, unprecedented. We've never tried locking down the entire population before in the history of the world. It's a great public health experiment. And, the early voices, as early as February the 3rd, there were researchers in Canada saying, whoa, maybe we're overreacting here. Like, this is the headline from February 3rd, National Post, new coronavirus may be no more dangerous than the flu, despite worldwide alarm, say experts. That was from the University of Manitoba and from McMaster University. And here we are now, this time later, the announcements that came in on the modeling were very alarming. In Ontario here, I have the paper beside me, from April the 4th, when they announced that grim projections, great big letters, if we stay the course between 3,000 and 5,000 deaths, and it could be 100,000 if we don't stay locked up. That's turned out to be an outrageous overestimation and probably the most, off-base public policy decisions have come out of this because of mathematical models that are based on biological assumptions that haven't materialized. And I just want to say that we now know, and we should know here in Canada, because others in the States where they've done much more testing have shown that this is really in the order of an influenza that we experience every year that we've been alive. I'm just a young guy, I'm 68. But the numbers in Canada for an influenza season are 4,000 to 8,000 deaths. And I'm not talking about illness, but death, are 4,000 to 8,000. And here we are, today's numbers for Canada are 3,180. And Ontario is just over 1,000. So the predictions, we're out of flu season, and it's clear that Canadians are coming out of flu season as we do every year. Seasonal flu, influenza, respiratory viruses. So I want to talk about something that hasn't been talked about in this story, and that is the risk to Canadian citizens and citizens of any northern nation who have dark skin, because I put out a warning to dark-skinned friends of mine across Canada and to pastors and leaders, if they have dark-skinned people, that their communities will be at risk. And so just basically I want to talk about that. I put it out to some high commissioners as well.
Now, could you unpack that for us? When you make that statement that those with darker skin in northern climates will be at higher risk of contracting, whether it's COVID-19 or another influenza-based virus, unpack that for us. What is that about exactly?
Well, the first indications came out quite early because Sweden did not lock down. And amongst the early casualties in Sweden were the Somali immigrant community. And 40% of the early deaths in Sweden were from that very tiny part of the population, less than 0.5% of the population, but 40% of the deaths. And the British Medical Journal picked up on that. So because I know the vitamin D file quite well, it caught my attention. And then, it came out that in the UK, which also was slower to lock down, like US, there were 25% of the deaths in the UK were amongst the immigrant community from the Middle East and from Africa. 25% of the early deaths. And the President of the United States is asking, why are African Americans overrepresented in the severe infections and deaths in the United States? And the answer he's got is not sufficient. In the following way, let me say that when they're challenged on this in the United States, our public health experts will say, well, it's because of socioeconomic conditions and inequality and overcrowding and cultural practices, and they're living in more densely packed areas. Well, I got to raise this question. Is it not true that the countries they came from, whether it was from Africa or from the Middle East, there's not overcrowding? And is there not poverty? And yet the deaths, a friend, a PhD student, for example, who lived with us last month before she went back to Uganda, the deaths in Uganda so far, zero. Egypt, 265. That was a couple of days ago, mind you.
Wow.
There might be one by now. And any of the countries you look at, it's not where they came from. They're at risk here in Canada. And why? And the British Medical Journal was the first one to comment on that. And I'll just quote a short paragraph here. A risk factor that we want to highlight, however, is the low vitamin D levels found in the Swedish Somali population. Vitamin D status is strongly related to low sun exposure and dark skin. And they go on to talk about Swedish women of Somali origin had very low levels, less than 25 nanomoles per liter. And Health Canada recommends we should be around 50, up to 50. And the people that know about cancers and autoimmune diseases are recommending that should be changed to 100 to 150 nanomoles per liter because there's a reduction in cancers. Respiratory infections are hard to find if your D levels are optimized. And they made a huge statistical error in the analysis that both US and Canada follow. So-called scientific analysis was done in 2010 by what was called the IOM, Institute of Medicine in the States, which has been proven wrong. The recommendation coming out of that was one-tenth of what we need to be well. That's a big mistake. So out of that, I just want to say that, is there other evidence that that vitamin D is important? Well, this is Harvard Gazette, February 15th, 2017. That's not so long ago. This is a man who's in charge of the Department of Emergency Medicine at the Massachusetts General Hospital. And the study's senior author, he says, our analysis also found that vitamin D, helps the body fight acute respiratory infection, which is responsible for millions of deaths globally each year. And he goes on to say, quote, acute respiratory infections are responsible for millions of emergency department visits in the United States, said Camargo, who's a professor of emergency medicine at Harvard Medical School. These results could have a major impact on our health system. So, and one more, because infants, is it safe for infants? And this is from the Pediatric Infectious Disease Journal, August 2018. Conclusion, high-dose vitamin D, 1,200 international units, is suitable for the prevention of seasonal influenza, as evidenced by rapid relief from symptoms, rapid decrease in viral loads, and disease recovery. In addition, high-dose vitamin D is probably safe for infants. They say probably because their study didn't have any problems, but usually they like mega studies to confirm this. So my question is, why don't our public health officials that are guiding our government know these things? And if they are, why aren't they expressing that to people? Because I think it's outrageous that people that come to our northern climates have got misrepresented data, at least in North America, on how much vitamin D they need their dark skin filters will not allow them to produce vitamin D for many months of the year, and it leaves them vulnerable. Now, we didn't see the same effect as the UK and Sweden and the United States. In Canada, I believe, because we did lock down earlier, and we're spread out more. We're not as dense. And so the virus did not have an opportunity, but we're likely to see this when we come out of lockdown. And tragically, here's a friend of mine sent this. Grammy-nominated gospel singer Trevor Sneed from the United States, a fine gospel singer, 52 years old, died from complications from the coronavirus. So I think that we need to ask our public health officials, and I'm hoping that our elected officials will be asking them to explain why they haven't explained to Canadians that vitamin D is a hormone, that it drives our immune systems, that our immune systems protect us, that vitamin D, we have it in the literature now. There's an explosion of information biologically about how vitamin D drives our immune system. It will persuade your cells, particularly in the vulnerable areas to respiratory viruses, to produce their own antibiotic, antibacterial, antiviral peptides that destroy the viruses and the bacteria before they can infect the body. And that's a low-cost intervention, Faytene, that, anybody that listens to me, if I had a black taxi driver in the last many years, they all get the vitamin D story. But if it's so important, and Harvard thinks it's important, and pediatric journals think it's important for infants who might be challenged. If the mother was deficient in vitamin D, the infant might be as well. And so it's important. It's an important public health measure. Why aren't our public health officials explaining that to Canadians and explaining, get your vitamin D levels up?
Well, I'd like to say this, James. That would be my question for you. As someone who sat on the health committee for years, you sat in caucus for years, you deliberated on the floor of the House of Commons. This is common knowledge in the medical community. And I'd also like to add, from my understanding, it's not just the dark skin communities that will benefit from vitamin D, but it's, people who have lighter skin as well. This is something that we can be doing for the common good, getting this information out there, also talking about vitamin C or just getting outside, getting some sunshine. That's my question for you, James. In your opinion, why aren't our leaders talking about this? And why isn't the mainstream media talking about this?
Well, sadly, I think so many medical doctors are very busy and they don't know that. I know a lot of doctors that are recommending D, and we used to test for vitamin D, but because of erroneous information from Health Canada, the attitude from most is, in fact, in Ontario, they stopped testing for D on the advice of our medical association, and it was because the assumption from Health Canada's data is that everybody's low. Just take 1,000 IUs, and don't bother testing. Everybody should take one because Health Canada says one's enough, and one is enough for healthy bones. If you take 1,000. But the raw data actually that they got from the United States has been analyzed by other experts. And they made a huge statistical error. The mega-analysis, they led everybody to believe it was a science-based recommendation that was 600 international units was what the average person needed to maintain optimal health. Well, it turns out they made a big mistake. It wasn't 50% off. It wasn't even 100% off. It was a full order of magnitude. What the raw data actually showed, the average person needs 6,000 to 7,000 international units. That's a big error. And, here's one of the articles, Nutrients 2014, a statistical error in the estimation of the recommended dietary allowance for vitamin D. And that was Dr. Paul Voigler's and John Paul Equaro. And that was published in 2014. And I was there. I was privileged, Faytene, to be in Ottawa when an organization from Alberta, and they're the real heroes in this story. They've been managing 44,000 clients and a research-based organization called Pure North, helping 44,000 Albertans by sending them the vitamins and minerals and nutrients they need to be well and accumulating statistics. They've saved Alberta hundreds of millions of dollars over the 8 years of this research project. And they're the ones that brought 12 of the top doctors to Ottawa in May 14th, 2014. I was there for most of the day. It was at the Chateau Laurier. And Health Canada representatives were there, and doctor after doctor talked about heart disease improvements, cancer reductions, 50 to 80% reduction in breast and colorectal cancers. That was the kind of thing you might think Health Canada would take an interest in. And they confronted them in 2014 with the fact that, but you made a mistake. How about correcting it? Because all of these issues beyond influenza are important. And they managed to hem and haw. Health Canada deflected to the Institute of Medicine, and they took 3 years to answer. That took us to 2017, and they finally did publish and acknowledge the statistical error because other researchers had been asking the same questions. And they decided the answer was they're not going to change the recommendation because they actually didn't use the mega-analysis. So apparently they preferred expert opinion to the science.
Okay.
And that's where we remain.
Wow. Well, it's very eye-opening. And Dr. James Lunney, I so appreciate you coming on just to shed light on this important issue. If nothing else, hopefully some Canadians will be watching this and amp up their vitamin D. I know myself, my husband, my children, we're all doing that as well, especially because we want our immune systems to be strong coming out of quarantine here, this quarantine season. But also want to encourage everybody who's watching this, if something is resonating in what you're hearing here, do the research, find out what's going on with this whole thing, and also share with your members of parliament, our elected officials, both federally and provincially, about the importance of not just talking about shutting our nation down, shutting our economy down, but also strengthening the immune system of the common person in Canada, those with dark skin, those with light skin, so that as we come out of this, we can be strong. Thank you so much for being with me today, Dr. Lunney.
Pleasure.